ladies and gentlemen, gentlemen of the press, let me once more welcome you all to the national briefing for Thursday, 4th of June 2020. The Presidential Task Force has continued to observe the takeoff of Phase 2 and implementation of the additional guidelines nationwide. State oversight of this phase of the response is very critical. The response needs to be decentralized to the local government level, identifying high-burden local governments and ensuring mapping of adequate support to rapidly trace, test, and treat cases. States need to drive aggressively campaigns to engage communities in order to address behavioral change and debunk misconceptions and stigma. Traditional and religious institutions have a role to play in sensitizing communities about COVID-19. In the last couple of days, the Presidential Task Force has received inquiries on some aspects of the guidelines issued. However, I wish to inform all Nigerians that they have been simplified as much as possible, and the dissemination has already commenced through the electronic and print media. The National Coordinator will continue to elaborate on the guidelines as frequently as possible. As we approach the weekend, we remind the public to be aware of the guidelines set for restricted opening of places of worship, national guidelines that have been shared with the states, and we expect that protocols will be agreed with our religious leaders where states have permitted the issuance of those protocols and the setting of the relaxation on places of worship. Compliance at this stage is important so as to avoid unwarranted consequences that put the lives of people at risk of contracting COVID-19. We urge for utmost caution at all times. The Presidential Task Force will continue to monitor the overall compliance of the easing of restrictions as well as evolution of any outbreak. However, we will not hesitate to review as we progress, should the situation warrant, to avoid preventable risk of transmission. You will recall that the hydroxychloroquine in the ongoing Solidarity trial on effective treatments of COVID-19 was temporarily halted by the World Health Organization on the 25th of May, 2020, pending review of all safety data by the Solidarity Trial Data Safety Monitoring Committee. The World Health Organization, as part of the efforts to find a cure to the COVID-19, has resumed the inclusion of patients in the hydroxychloroquine arm of the study. The Presidential Task Force, however, advises against self-medication in all circumstances. As we have always urged, it is important for individuals to take responsibility. As we go into community engagement, citizens should cooperate with agents of the state governments, the local and community authorities, as well as their leaders in their communities. We have received reports about citizens refusing to help with contact tracing, as well as going into isolation after testing positive. It is in the interest of everybody that contacts are traced so as to slow down the spread. It is also in our interest to go into isolation facilities for close monitoring. A number of fatalities have been recorded due to change in the condition of patients while staying outside the isolation facilities. Our appeal is that if agents of the state get in touch with you regarding testing, contact tracing activities, please cooperate with them. Also, let's be prepared to be quarantined and to monitor our health for onset of symptoms, because it is important for us to break the chain of transmission and prevent the further spread of COVID-19 in our dear country. Earlier in the week, we raised the red flag and enumerated our efforts to cut down the rate of infection among medical workers. The Nigerian Center for Disease Control is stepping up training on infection, prevention, and control to slow this emerging situation down. We need our health workers to be healthy and available. As always, we remain very proud of you all. We are now in the planting season, and our farmers have been involved in land preparation and planting of crops. To guarantee a seamless flow of agricultural activities, the guidelines have exempted the agricultural value chain from the restriction put in place. It is therefore important that we do everything possible to guarantee our food security by supporting our hardworking farmers to function. I therefore appeal to all our various task forces and security personnel at the subnational levels to ensure easy passage of these inputs to our farmers. Ladies and gentlemen, I'm pleased to inform you that we have continued to receive support from our development partners. Yesterday, the International Atomic Energy Agency delivered test reagents, kits, and a PCR machine in our effort to combat COVID-19. We are appreciative of this venture and note that the equipment will go a long way in boosting our laboratory capacity and testing of infected persons. I now call on the Honorable Minister of Health, the DG, Nigeria Center for Disease Control, and the National Coordinator to update you before we take questions. And I thank you for your patience and for listening.
Good afternoon, everybody. The chairman of PTF, honorable ministers, permanent secretaries, directors general, ladies and gentlemen. Building on the speech just given by the chairman, I will first of all start by saying that Nigeria currently has crossed the 1,100 line and has a total of 11,166 confirmed COVID-19 cases in 35 states and the Federal Capital Territory, of which 3,329 have been treated successfully and discharged to their homes, while we have sadly recorded 315 fatalities. The daily epidemic curve of confirmed cases shows a consistently rising trajectory with corresponding increase in fatalities, but it's not comparable with what is observed in some foreign countries. But to rest on our oars for that reason will be a serious mistake. COVID is real, and we have explained that the increase in cases is due to improving testing capacity and also activities in other pillars such as surveillance, community mobilization, coordination, contact tracing, and also aspects of demographics and other not so very well-known factors. The team from the Federal Ministry of Health that was deployed to Lagos and Ogun State, led by the Executive Director of National Primary Healthcare Development Agency, has returned. Thank and appreciate the Nigeria Air Force. They have supported us in all our movements. At every instant, they have made transport available, and they have never said to us that they can't. I want to thank them in the name of all Nigerians. The team returned with optimism about having gained a better insight into the state-specific challenges and gaps where they visited. And they had audience with the executive governors, visited the state EOCs, and exchanged ideas with state health teams. A full report of findings will be ready next week, but preliminary findings are the same as we found everywhere, that the treatment of routine and essential cases has dipped a little somehow because of fear of COVID and also because of less patronage by persons who are afraid to go to hospital. But in the team were also a good number of people from Primary Healthcare Development Agency, Department of Family Health, Department of Hospital Services, NCDC, who were able to interact with all the counterparts in the states to develop a very good professional handshake. We are optimistic that the benefits are going to be seen very soon. The Federal Ministry of Health team to Kano, Sokoto, Jigawa, Borno, Katsina, and Gombe will be submitting their final report in a presentation to the Ministry of Health tomorrow. We shall share the results with you later. But the preliminary reports also show that the goals of the intervention were met. On Tuesday, the 2nd of June, I had the privilege of chairing a virtual meeting of ECOWAS COVID-19 Ministerial Coordinating Committee on Health, hosted by the West African Health Organization and attended by 15 ECOWAS ministers of health, and a few of them were represented. This is the first time West African ministers of health are meeting virtually, but they had met earlier in Bamako a few months back, and the Honorable Minister of State was at that meeting. This Committee on Health is one of 3 committees. The others are committees on finance and transport of the ECOWAS region, and they were set up to facilitate the work of the ECOWAS COVID-19 response champion in the person of His Excellency President Muhammadu Buhari, who was elected into this role on April 23rd, 2020, at a virtual meeting of ECOWAS heads of state and government. The attempt of West African leaders to address this common problem. At the meeting, we compared notes, discussed matters of regional cooperation and collaboration around COVID-19 strategy and response. We also discussed border-related challenges on movement of people and goods when borders are reopened. West African Health Organization and Nigeria are presently working together on a cost-sharing plan for a common air transport aircraft to convey COVID-19 supplies belonging to WAHOA to Nigeria from Beijing to Abuja. I also had the honor of presenting the statement of His Excellency President Buhari at a virtual global vaccine summit this afternoon, hosted by UK Prime Minister Mr. Boris Johnson. And the purpose was to mark 20 years since Gavi was founded. Gavi is a global alliance for vaccine and immunization. And the purpose of the meeting was also to raise funds to support the activities of providing vaccines to low-income countries. Just as we continue to engage states, we shall also continue to engage communities, religious and traditional leaders for sustained messaging to citizens. Also on the importance of adhering to health advisories to combat community spread of COVID-19. I again emphasize that much at this stage depends on a trust-based partnership between people and government to faithfully obey the rules on COVID-19 as laid down for our own common good. Support to our states will be tailored to the challenges and strengths of their health systems. The National Primary Healthcare Development Agency is discussing options and guidelines of supervised out-of-hospital isolation and care with some states, which is either home-based care or based in communal space, like school dormitories, since schools are presently closed down. As we continue to engage states on scaling up sample collection and testing capacity all over the country, we also continue to urge healthcare workers to ensure that they are protected with appropriate personal protective equipment and continue to exercise a high index of suspicion when treating patients. This is not the time to be careless. This is not a time to take risks. But it is also a time to listen to all patients, not to send people away. You can give them at least an advice. And if you are at safe enough distance, you will generally also be safe. To comment on the various test kits that are thought to be in use in Nigeria, especially the antibody-based test kits, I would like to advise that only 4 of those kits have been evaluated by the Medical Laboratory Science Council of Nigeria, and all 4 of them failed the validation test. None of the antigen test kit has yet been evaluated. But what it means is that results obtained from these test kits, they're not tenable for diagnostics, and they're deficient in sensitivity and specificity, and are likely to give false results and mislead people. NCDC certified laboratory in Nigeria is still the WHO-recognized PCR testing method, which gives us reliable results. Though expensive, this option is the right one. And right now we have over 30 laboratories in a network. And as you heard just now, one PCR machine just came in. And the aim is to establish at least one laboratory in every state, at least. So I would like to advise again all citizens to please put on your mask for your own safety and your own protection, and for the protection of others. This is one of the few easy steps that we can take to protect ourselves, particularly when we're in a crowded environment. We know that physical distancing is not always feasible, it's not always realistic to be expected. Therefore, you need a barrier of this nature as a minimum protection, but not the only protection, not the sole protection. We still encourage distancing as much as possible, the use of sanitizers, hand washing, open your window for fresh air wherever it's safe for you to do so. And also wear your mask even inside your house if you are not sure of the COVID-19 status of people you are living with in a locked environment. And remember the respiratory hygiene, the use not to cough into the open space, but to use tissue or a handkerchief. Thank you very much for your attention.
Honorable Ministers, gentlemen of the press. My comments will be very brief. Last week I mentioned that we're working on new case management guidelines. So we've now published the third version of our case management guidelines on the NCDC COVID-19 website. Like I said, there have been new science emerging about the duration of infectivity of individual patients, one that themselves infected, which led to the WHO issuing new clinical guidelines. We then convened colleagues across the organization, across the Federal Ministry of Health with the case management lead, Department of Hospital Services, in the Federal Ministry of Health, as well as other colleagues with whom we work, to review our guidelines and issue new guidelines for the country, of course adapting it to local circumstances. Now, the key thing is that the management of COVID-19 remains primarily supportive. We don't have any treatment so far that has any proven impact on mobility. So the 5 general areas of management are supportive management of the symptoms the individual has, managing whatever pre-existing conditions, supplemental oxygen therapy to different extents, treatment of bacterial infections. So very often when you have a viral infection, you are liable or you are susceptible to a superimposed bacterial infection, and ensuring that patients are well nourished and well hydrated. So in practical terms, what does this mean? One of the major changes that has happened is the discharge criteria. Now, while these guidelines are obviously primarily targeted at physicians managing patients, it's important that patients themselves know and people know, because this is a disease that really we're all involved in collectively learning in real time and managing ourselves and managing society. So the 2 critical groups of patients are symptomatic patients and asymptomatic patients. So for symptomatic patients, they may now be discharged 10 days after symptom onset, at least 10 days after symptom onset, and at least 3 days without symptoms. So if you're symptomatic, you can be discharged if you have had 3 days without symptoms, in addition to at least 10 days of symptoms. Of course, if your symptoms last for longer, we will wait for longer while managing you supportively, like I said earlier. If you're asymptomatic, we can discharge you. You can be discharged 14 days after your first PCR positive test. So we no longer have to wait for a negative test to discharge. You can be discharged 14 days after your first positive, with confidence that you can go home, that you're no longer infective, and you're not at risk you're not putting your family, your friends, or anyone else at risk if you're asymptomatic. So these have come out of science. We're confident on its impact. Change is difficult because we've been saying you have to have a negative test. So even though we've published these results, many physicians are still hesitating to use them, but we can assure everyone managing cases that 14 days after, in fact 10 days is what the evidence says, but we've added 14 days to make it a neat 2 weeks for people to then implement discharge for patients that are asymptomatic. In addition, we have also removed the use of antivirals from our treatment guidelines. Like the Honorable Minister just said, the trials for chloroquine and hydroxychloroquine will go on, and we have no problem with that. But we are asking that we restrict the use of these medicines to those trial settings and not use them casually around the country. So if you want to, let's restrict the use of chloroquine, hydroxychloroquine, and all the other antivirals previously in our guidelines to contexts where clinical trials are going on, so that we don't use things that we're not sure about their use. So that's the second major change. The third one is more for us. We've clarified how we define a death from COVID-19 so that the reporting of this is more straightforward and standardized across the country. So in conclusion, these new guidelines are on our website. We have already distributed them to all commissioners of health, all CMDs of tertiary hospitals, all state epidemiologists, all incident managers across the country. But we know we can't reach everyone, and we have to reach as many people as possible. So we're really encouraging all the physicians watching this to download those new guidelines. We don't print massive copies of them because this is a new disease, and it's likely that we will keep learning. This is the third version in 3 months. So we have not spent a lot of money printing guidelines. We advise you download them from the website. You can print them for your own hospital, but don't print too many. We will, or print as many as you need in your own context. We will keep reviewing, not just us, but the global community. Everybody is learning at the same time and offering Nigerians the best evidence possible and the best support they need to manage cases. So I really want to thank everybody that has been part of the review process, especially the Director of Hospital Services, my sister Dr. Debbie Abebimpe of the Federal Ministry of Health, and many other friends, collaborators who worked tirelessly to get this document out on time so we can use it to manage our patients more effectively. Thank you very much.
Honorable Ministers, members of the PTF, gentlemen of the press, good evening. First of all, I would like to briefly talk about the impact of COVID-19 on our health services, both in terms of the quality and also access to care. As you're aware, as a result of the COVID-19 pandemic, the whole world has engaged in an unprecedented response against this virus and against the disease, and quite rightly too. However, as a result of this, we are seeing a situation where other health conditions are not, health services are not concentrating on other health conditions. If anything, the emergence of COVID-19 has led to the detriment in terms of care for other essential health services. And this negative impact included reduction in health services that could arise from disruptions in medical supply chains or the availability of human and financial resources. And also in a decline in people accessing healthcare simply because of fear of getting infected by COVID-19. We've also seen reduced access to healthcare for medical diagnosis of other conditions, and for the most vulnerable populations like children, the elderly, and those with underlying illnesses such as diabetes. As I've said in the past, if you have fever today in Nigeria, it's far more likely it's going to be due to malaria than due to COVID infection. And people need to be able to access care. We have been observing a steady rise in maternal and child mortality as a result of disrupted essential services. We've also seen life-saving maternal, newborn, and child health services, routine vaccinations, access to care for chronic conditions such as HIV, and other treatments not being delivered in our hospitals. We are also seeing diversion of certain products like second-line HIV drugs, for instance, lopinavir, ritonavir, that's being used for HIV treatment. That's currently being used for COVID infection. And as mentioned by the DG NCDC, we are asking health institutions to make sure that they have proper assessment processes for people presenting with possible COVID. They must have holding areas and screening areas so that their staff can protect themselves and at the same time be able to deliver care. Hospitals are there to look after patients. Hospitals are not there to turn patients back. People should not be allowed to suffer or die because of COVID infection. We must not allow preventable deaths to occur in our communities simply because of COVID or because we are afraid of it. The PTF will continue to protect the health and safety of health workers, both in the public as well as the private sector. We are appealing to the private sector facilities to make sure they have adequate PPE to protect their staff. From the government side and from PTF, we will continue to engage with the private sector to train them on infection control processes. But PPE will primarily be given to public hospitals and to other frontline workers. We expect the private facilities to make adequate arrangements for their own PPE. If they are having difficulty accessing this, they should please get in touch with us and we can point them in the right direction. Having said this, we continue to thank our donor partners and our partners within the private sector, particularly the few that continue to provide excellent care to persons with COVID infection. The second issue I wanted to briefly mention is the issue of public sensitization. As you're aware, we are now pushing through the next phase of the response, which will be all about risk communication and community engagement. We will continue to work with all parts of the communities, religious leaders, traditional institutions, state and local governments, to make sure that that behavioral change we all need to adapt continues. We must learn to live with the new realities of COVID-19, especially as we are still far off from a permanent solution to the pandemic, such as the availability of a vaccine. All of us must take responsibility in protecting ourselves and others by adhering to the health protocols and lockdown guidelines while we go about our lives in this, what we call the new normal. Because post-COVID, things will not be the same. Finally, I wanted to again inform the public that the PTF has not been giving out contracts. The PTF is not a procurement body. We understand there are a lot of fraudulent letters going around trying to sell contracts to members of the public. So buyers beware. We are not signing off any contracts on behalf of the PTF. Thank you.
Appear to be related. If I understood Juliana properly, because you have to do your question 2 times, you are talking about those who are positive but say that they are negative. And it's connected to the very last question now. It's been said that a good number, perhaps up to 80% of people who are positive for COVID-19 will have no symptoms. Or they have very mild symptoms, up to 80. So the symptoms can be so mild or none at all. And those who have no symptoms will not believe you that they are positive, because they look at TV and they see people collapsing, they see intensive care, they see people being intubated, and there's nothing wrong with them. So they don't believe you that they are sick. So you do have a problem trying to convince them that they are positive, and you are going to put them in isolation, not because they are sick, but because you want to keep them away from infecting others. So you do have that issue that people dispute their result, and in some cases you have to do the result 2 times or 3 times, and they still don't believe you. So some people can be asymptomatic that they are walking around and you don't know. Again, you also have the issue of people who test and they're positive and they have no symptoms and they think you are going to look for them, they run. They go into hiding or they disappear. So that's the question that we're asking, why the figures don't tally. The reason is that those who think you are going to trace them, contact tracing make it difficult because they don't want to go into isolation. You remember the photos we saw, the clips we saw from Gombe, where young men who were all positive in an isolation center were marching out along the street, disputing the claim that they were sick or that they had COVID. Those are the ones who have those symptoms. So you do have quite a very strange and odd picture presentation of this disease. Also, we say that the very old people will likely lose their lives, but there's also a report of a 103-year-old woman, 103, who had COVID-19 and survived. So you do have some who will survive, and also very young people who pass away. Then you have a picture of those who look very well, and then suddenly their condition changes. Within a day or 2, the next thing you hear, they're in distress, and before they rush to the hospital, it's late. So it can change dramatically and very suddenly. So the best thing is to err on the side of caution. Trust your doctor, trust the caregiver, and do what they say you should do, what is good for you, what is best for you, and not try and take your own decision by yourself, because we don't know enough about this disease to be able to be sure that we can take care of it ourselves. So the best thing is to trust your caregiver, go into a center where you are isolated or where you are in treatment, and until you are told you are okay, then you can leave and go back to your house. So I think that answers all these questions about asymptomatic and isolation. Where are they? The reason is that they are not in the system. Many of them are not there. You can't track them. And that's the reason why we do have cases of community transmission going on.
Gentlemen of the press, a few questions here. Firstly is on healthcare workers and risk of infection. You know, right now we're doing everything possible to protect our healthcare workers across the country. But I do think that in the long term, there needs to be a much more fundamental change around how we deal with infections, infection prevention and control in our settings. And that change needs to really come at 3 levels. Firstly, our hospitals, both public and private, now really need to include personal protective equipment, the purchasing of it, in their procurement plans, in things that you have to buy to keep your hospital going. What we're doing now is simply a response to an outbreak. You know, managing logistics, sending around PPEs across the country. That's definitely not what we should be doing as a country. So that has to change as we refigure our health system to include this. And yes, these things are expensive, but you have to include it. Health care can become expensive, or whatever the cost is, it has to be factored into the cost of delivering health care. There's no point in having a hospital, a doctor, a nurse working if she can't have the personal protective equipment that she needs. So I'd like to answer that in that context. The second aspect is our doctors. You know, we've been saying this severally as We've managed small outbreaks of infectious disease across the country. But now there needs to be a much more fundamental change in our ability and use of PPEs. So we need to become comfortable with masks and gloves. We need to push harder as doctors, as nurses, as medical lab scientists to ensure that there's running water in our clinics and insist on these things. Yes, it will take some time to get there because we can't solve the problems of 60 years in 6 weeks, but we have to start pushing on these things. And the third aspect is on people. Really, patients themselves. We are all patients. We can all become patients, and we have all been. When next you visit your clinician and he wants to examine you without a glove, I encourage patients to ask their doctors, why don't you wear a glove? And ask them and push them. So there's a much more deeper change that needs to happen across our sector that will start happening. And we're working on this as we try very hard to solve the short-term problem. We have a short-term problem. We're managing logistics of sending out PPEs across this diverse country. The states are buying their own. The private sector has done an incredible work. The UN family, everybody is working very hard to make sure we have the PPEs we need to work now. But in the longer term, we really need a different relationship, a much closer relationship with both the training and the materials we need to prevent infections. Secondly was the question on post-discharge management. To be honest, we're not suggesting people are discharged while they're still symptomatic. So we're talking about discharging people that are asymptomatic and have recovered. Either you are symptomatic and you have recovered, or you're completely asymptomatic throughout your, through your clinical episode. So at that point, you really don't need much more clinical intervention. Even at home, you just need time to recover. If you have been weak, if you're just like you recover from any other illness. So you're no longer a threat to public health at that stage. So you don't need any special intervention once you've been discharged. Thirdly, the work going on to validate test kits in Lagos. You know, in the middle of, there's no doubt, Lagos is the most affected from this outbreak. They have half the cases in the country. Of course, if you're affected the most, you would try harder to solve the problem. So if they're pushing on some of the research that we need to do to solve, make our decisions, we are grateful. So there's no conflict here at all between federal and state. Actually, you know, if you do the tests and provide the data and show that one kit is validated, by all means, we will run with that. So right now, everybody is working together to ensure that we have the data that we need to make the decisions that we need to make into the future. On treatment of non-COVID patients, I think the Honorable Minister has answered that. I won't go into the issue around the sample from Kogi. I think we've done enough of that. And there was a question on the antiviral drugs that we've left out of the guidelines. You know, when there's a new disease, and this happens with every new disease, just that sometimes none of them attracts this level of attention, you first reach out for whatever you have. And that is really what we did at the beginning of this outbreak. So we reached out to some, you know, antiviral drugs. One that was in our guidelines previously is the lopinavir, ritonavir combination, which is a drug we use, a combination of medicines we use for HIV. So we look for whatever we have to try. But as evidence emerges and science improves, then we have to start making hard choices. There have been quite a number of studies now that have shown that they don't really improve the outcome of this illness. So we've withdrawn them from the guidelines for management. However, we have kept them within the clinical trial so that we can study and see whether they work or not. And that's really the rational approach to this. So that's really what we have done, and while we continue to do the best we can. Remember, no drug has no side effects. Every drug has side effects, so we always have to balance the good it does with the harm it causes. I think that was it. On the use of drugs, this is the use of certain medicines is called the compassionate use of certain drugs. The fundamentals are still the same. You have to think that that drug works. And sometimes when research is still going on, you say, okay, you can use this drug on compassionate grounds when a patient is, doing very badly, and at that point, it really doesn't matter. You're trying something, right? And every clinician has the right to do that. That's a doctor's prerogative. When you have a patient that is very ill and is looking bad, you have tried whatever you have, and then you now use drugs that there's no evidence that they work, but you use it on compassionate grounds. And of course, they can still use any of these drugs on compassionate grounds during the appropriate circumstances.
We change the timing for the curfew. So, as we all know, coronavirus is a respiratory viral infection. It moves from one person to the other. So, for you to get infected, it needs to move from an infected person to you. So, any measure that will interrupt that transmission, whether it's by putting physical distances between people, or reducing the opportunity of people meeting each other, or putting physical barriers such as masks, or keeping people away such as staying at home, will interrupt that transmission. And once the virus is unable to move from one person to the other, either of two things happen. It's either your immune system gets better and it gets rid of it, or people succumb to it. But whatever is the case, the epidemic stops. The purpose of the curfew is to reduce interaction, social interaction between people. It's not an election curfew. So by maintaining the curfew from 8 p.m. to 6 a.m. initially, we were doing so at the beginning of the pandemic, where we were trying to address a host of issues. We've now moved to the next phase where we've reduced the hours. The 4 a.m. expiry for the curfew would have been 6 a.m., but we understand there are certain parts of the economy, especially in Lagos, where people have to start getting ready to go to work very early on, which was why we moved the 6 a.m. to 4 a.m. But we moved the 8 p.m. to 10 p.m. In order to allow the economy to continue to move, while at the same time reducing the risk of people congregating for social events, etc., and possibly transmitting the virus. So at the same time, I very much appreciate the issue of domestic violence, the issue of emergencies, and the need for people to move around. And we expect the security services to respect the exemptions we have given. The IG of police has already requested that we write him formally explaining the various exemptions so that this can be forwarded to his men. And we'll be doing so, and we'll include the issue of emergencies. People should be allowed to get to hospital. If it's an emergency, it's an emergency. We're not zombies, so we expect the security services to be able to take that decision on an individual basis. We don't need to spell out every single emergency situation for the security services to understand that there's that need for movement. I think the only other issue I had was the issue of a national guideline on outbreak of diseases post-COVID. Well, hopefully post-COVID, we're not going to have seasonal pandemic situations. At the moment, the guideline we have is sufficient enough to address our issues now. There have been other national pandemic response plans that include plans for influenza, etc. And coronavirus and other emerging infections will be included in that. But for the moment, we are facing what we are facing, and we'll continue to work with all parts of society to make sure that this pandemic comes under control. Thank you.
The task force, ladies and gentlemen, we were asked to elaborate on why hydroxychloroquine was suspended and why it has been reinstated. Just to recall that the use of hydroxychloroquine in the ongoing Solidarity trial on effective treatments for COVID-19 was temporarily halted by WHO on 25th of May 2020. And the trial was paused, or the use of hydroxychloroquine in the trial was paused after a publication in the Lancet that concluded that hydroxychloroquine was linked to higher rates of mortality and heart toxicities in patients with COVID-19. The suspension was taken as a precautionary measure pending review of all the safety data by the Solidarity Trial Data Safety Monitoring Committee. This suspension lasted about 8 days. Yesterday, the Data Safety Monitoring Committee met, and based on a review of the available mortality data regarding the use of hydroxychloroquine for treatment of COVID-19 patients, and also considering information from a large trial ongoing in the UK, the recovery trial, where the Data Safety Monitoring Committee of that trial also reviewed their data. The members of the committee agreed that there was no cogent reason as to recommend the modifications of the protocol, and they advised that the trial should be continued as planned. The executive group of the study therefore decided, based on the advice of the safety committee, to resume the inclusion of patients in the hydroxychloroquine study arm of the trial. Just to remind the public, WHO continues to emphasize there is still no evidence that hydroxychloroquine or any other drug is effective in treating or preventing COVID-19. And to also remind that drugs are used strictly for the purposes of the trial, and self-medication continues to be recommended, that we should not embark on self-medication related to drugs for COVID-19. Thank you.
Distinguished ladies and gentlemen, members of the press, 2 questions. One, update on disinfection, decontamination, which is the simpler one, so let me answer that first. The second one, kind of intertwined with nature, humans, coronavirus and all that. Update on disinfection, decontamination is continuing. As I have said earlier, we're in all the 6 zones right now. In fact, tomorrow we'll be decontaminating and disinfecting the hotels where the returnees were kept. So we are doing this continuously. Our last sitting with the aviation industry is the critical one because of the nature of the industry. We just finalized that because they have chosen the kind of chemicals that they feel is compatible with their industry because of its nature of safety and security. That is done. We'll be moving on to schools. Last time I told you we have started, is ongoing. We will get a list, an extensive list perhaps, and share it to you in due course. Coronavirus, climate change, nature, people are all part of nature. Viruses are part of nature. And viruses can infect animals and infect humans. And coronavirus is said to be zoonotic, meaning it can traverse between animals and people. And research has shown, perhaps it came from bats or from pangolins. It's not unusual because bats also carry rabies. The same thing with dogs and foxes. And people go close to animals all the time. How it got to the first index or whatever, nobody knows how. But they are all part of nature. Climate change. We aggravated the issue of climate change, humans. because the world from the beginning was in perfect harmony with itself, balance. Land, water, air, amount of chemicals in the atmosphere in the correct proportion. Well, industrialization aggravated the situation, and now we are fighting the climate issue, trying to stabilize it. Coronavirus also, we know, in terms of nature again, in hot temperatures, high humidity, in the presence of UV, that sunlight doesn't do well. Again, interaction between nature and corona, and then us. So what do we do? How do you resolve this? Right now, the best thing for us as humans is, one, to continue the effort of stabilizing the climate. That's being part of the climate action. As far as coronavirus is concerned, we must just simply adhere to the measures that have been put together, that we repeat on a daily basis. For now, is the best. But in the end, way after corona is gone, the climate issue will still be there. So the new normal that we say is, for now, to learn to live with corona, with all these measures, because we don't know exactly when the virus will disappear and will go completely, whether it's going to come back or not, we don't know that. But our best bet is to make sure we maintain all that was said, the social distancing, the hygiene, wearing the mask, all of that, until the foreseeable future. That is the new normal. And in climate change, that is what we also call adaptation and resilience. So if we are trying to adapt to climate change and become resilient, now we have to adapt to corona and also become resilient. In the presence of corona, still be able to move forward carefully without aggravating the situation, spreading the infection any further. Thank you.
And members of the PTF, COVID-19, gentlemen of the press. I believe the question is whether Nigeria is planning to launch a national campaign to rally citizens towards productivity along the line of what's happening in South Korea. I think every nation will decide at the appropriate time what kind of national campaign is going to launch. The kind of campaign you are going to launch will depend on the kind of challenges you are facing and also your vision. At different times, Nigeria has launched various national campaigns, either against indiscipline or against corruption or against insecurity. And I remember that even during this administration, in the last 5 years, we've launched several campaigns, depending on what in particular is a challenge or what is the vision. When insecurity was the major problem in this country, I remember we launched a very successful campaign, even if I say so. If you see something, say something. That was meant to actually galvanize Nigerians, right around them, and make them appreciate the fact that security is not just the job of the police or the military. At the point in time also, we had to launch another national campaign to give support to the military. That also was still running on our television. At a point in time, we were convinced that the major problem facing this country is that everybody is passing the buck. And everybody believes that, it's not my problem. And that's when we launched the Change Begins With Me campaign, which Mr. President graciously, launched himself. And since the advent of COVID-19, we can see that all our platforms, whether it be television, radio, newspapers, or even the social platform have been awash with this, with campaigns. So really, a government will look at what is the major challenge or the current challenge and the vision of the government to launch a campaign. The campaign about productivity, has been launched in several way and manner over the past, years in Nigeria. And all I can assure you is that we would watch and see what are our challenges and what are our visions, and we will launch, national campaigns that is going to embrace people, the whole nation. As a matter of fact, even during the last administration, when we found that fake news was the biggest challenge, and it's probably still the bigger challenge we are facing today, we launched a national campaign against fake news, which took us to most newspaper, radio, television houses, and we sought and obtained their support. So really, it's not a one-off thing. You look at the temperature of the country, you look at what you are facing and where you are going, and you launch appropriate campaigns. Thank you very much.
There was one that had to, from AIT, I think it had to deal with evacuation. We just suspended the evacuation process because we are in placing a new protocol. And once that is put in place and all the logistics are also established, because you learn from experiences and through processes. At least we've received different evacuations now with a different protocol. We've seen the gaps, we've seen the challenges, and because of the evolving nature of COVID-19 in itself, as a virus and as a pandemic, protocols are changing all over the world. So we are putting in place a new protocol. Once that is established, and the processes for the implementation of that protocol is certain, the evacuation process would continue. So we appeal to our people, wherever they are on the face of the earth, to exercise more patience. We know they are eager to come back home. Some of them went on medical tourism to other countries. And after they've gone through their bouts of treatment, they want to return to their loved ones.
for the nation, for the people, for your community. Also behind me, you will find some signs. They came out of the signage factory of the Federal Road Safety Corps. They are delivering messages to Nigerians. We urge agencies, organizations that wish to have such signs to look inward, patronize the Federal Road Safety Corps, the signage factory, to produce this type of signs for your offices, for markets, for all public spaces. Well, a number of messages have come out of today's briefing. We'll focus today on the citizen in particular. As we continue to engage states in risk communication and community ownership, the time has come for the citizen to cooperate in contact tracing, testing, detection, and isolation. Let us be prepared to go into isolation when the result is positive. Do not go underground. Let us be responsive to policies and campaigns initiated by government. It is for the good of our nation. And as we cross the 11,000 mark, it is critical for us to break the chain of transmission to prevent further spread. Remember to wear your mask properly, not on your chin, not on the side of your face. Observe all non-pharmaceutical measures prescribed. Do not pick and choose. Now, this is to the whole nation. Please, some people are peddling contract papers. As has been said by the national coordinator, the PTF is not a procuring entity. It has not awarded, neither will it award any contract. If they offer you papers, contract papers to buy, alert the security agencies. They are fake papers and they are out to defraud you. God bless Nigeria. We hope to see you tomorrow by the grace of God. Thank you very much. Oh, I'm used to seeing our friends. We hope to see you on Monday by the grace of God.